know your benefits. Most people that buy HMO plans don't know their benefits. And let me tell you something, for those people that tend to hop from one HMO to the other, let me just tell you, all HMOs, we use the same sort of benefit structure. Hello, my Red Tribe, and welcome to another episode of Dr. Red Diaries. I'm going to continue talking about HMO, National Health Insurance Scheme, health insurance in Nigeria. But today we'll be talking about the benefits, what every Nigerian can benefit from the HMO health insurance plan. Let's get into it. All right, what are some of the benefits you can enjoy under your health insurance plan, irrespective of the premium amount that you're paying monthly or quarterly or yearly? Basic health care. You can access basic care. In the HMO space, we call it primary care. You can access primary care. And most times, irrespective of the plan, the primary care can even be unlimited. Means that you can go to the hospital at any time of the day. And hospitals registered under the HMO though. Under the HMO you're subscribed to. So you can go to those hospitals, that hospital registered or subscribed to that HMO at any time to access primary care. And primary care are treatment for malaria, upper respiratory tract infection, cough and catarrh or flu as we call it. Some outpatient treatment for typhoid, for mild sepsis, for UTI, urinary tract infection. These are some of the basic primary care that you can actually access at any time without restrictions under the health insurance plan. And like I said, even under the smallest plans currently be sold in Nigeria. You can access some investigations, either the basic ones, even up to some intensive or comprehensive investigations like MRI, CT scan. Even though they have limits, yes, with some HMO plans, you can actually have access to that. You can have access to preventive care. You can have even access to annual medical check for some HMO plans. You can have access to surgeries, optical, dental care. You can have access to even some mortuary services. You can have access to maternity services. You can have access to your children if you have kids. You can have access to immunization, to seeing specialists. There is a wide range and a host of things you actually have access to under the HMO plan. The truth is, there are a lot of Nigerians that are enjoying health insurance. They're enjoying the benefits of health insurance. Now, let me even paint a picture for you. If you go to the hospital now, and I really want us to be honest with ourselves, when we go to the hospital today to treat malaria, for example, you feel you have malaria and you go to the hospital to treat it. Right now, most people spend the minimum of maybe 50,000 naira to treat malaria. You pay for registration. You pay that registration fast for the card. You pay to see the doctor. You pay for some investigations. You pay for the drugs. Sometimes you spend minimum 50,000 naira. There are some people right now that their HMO plan in a year is maybe 25,000 naira, what they are paying for yearly. And when they pay that 25,000 naira yearly, they can access treatment of this malaria for free without making any form of payment. What really causes most of these issues when people come out to say HMO is a scam or whatever it is because they don't understand what the plan that they got, what it covers. They just have the assumption that as long as I pay for my HMO, it covers everything. No, it does not. If you've not seen the previous episode when I spoke about the fact that HMO is managed care, go and watch it and have a clear understanding about the basic information about health insurance. No, it does not cover everything, but it covers the most important things. And think about it too. HMO really helps HMO is like providing subsidy in that sense for the amount you're going to spend or your expenses for healthcare. We all know right now that to pay, if you fall sick, and falling sick right now in Nigeria is a lot of risks that a lot of people don't want to even take. People say you can't afford to fall sick, but guess what? You can't necessarily control what really happens to you to a certain degree or to a certain level. No matter how healthy you really try to stay or to keep fit. You can imagine how expensive it is, how expensive healthcare is currently. With HMO, it helps to subsidize that amount. It helps to reduce, not relieve, reduce that burden. If you want to access optical or dental care, instead of paying, let's say, for example, the optical or dental care you want to access, let's say is 50,000 naira, for example. With some basic HMO plan that you're paying for 25,000 naira, for 30,000 naira in a year, it reduces the amount. You know what it means for you to pay a certain amount, let's say 50,000 naira yearly, and you have access to surgery, to optical, to dental, to unlimited access to primary care, to sometimes even covers maternal services, that's antenatal care, CS, or even vaginal delivery, oral contraceptives or family planning, and a host of procedures. You can imagine, and most people still come out to say HMO is a scam. The truth is, HMO is not a scam. Most people just don't understand their benefits, or most people just want to pay a certain amount and expect that everything's going to be covered. Now, let's talk about one aspect of health insurance. In the previous episode, I mentioned that the reason why most people have coverage for HMO is because their company provides it. Another thing about HMO that a lot of people don't know, and that's the reason why most people call HMO scam, is because there's a popular saying in the health insurance space that the healthy takes care of the sick. If you're under a corporate HMO plan, people that are not falling sick are paying for the people that fall sick. Let's say, for example, you work in a company of 100 staff, and the company pays, or you pay together with other member of staff for your HMO plan, monthly or however the payment plan is. And you don't use your HMO for 1 year. And then you come back the next year to say, oh, the plan that you paid for last year, they should use it for this year. I'm sorry, they're not going to use it for this year. Because aside from the fact that HMO or health insurance is non-refundable, this is the reason why it is non-refundable. And this is the reason why you cannot transfer it into the next year. Because of what I said earlier, the healthy takes care of the sick. If you don't use your HMO plan for that year, you are part of the healthy people taking care of the sick. Because it's a pool of funds that is put together. That's the reason why the HMO plan is 50,000 naira a year. And you can access surgery worth 300,000, sometimes even up to 500, sometimes even up to 1 million naira. And you paid 50,000 naira or 100,000 naira or 200,000 naira. You can access optical, dental. You can access being admitted, sometimes unlimited amount of admissions, either in a private ward, in a semi-private ward, or in a general ward. You can access care up to 2 million naira, and you are paying 100,000 naira in a year. Sit down, analyze it, think about it, and give me your feedback. It's because the healthy is taking care of the sick in that pool. So if 30 people, for example, or 50 people fall sick out of those 100 people, that premium that you pay to the HMO, that is the money that the HMO would now use and spread across to take care of the 50 people. That's the reason why most times at the end of the day, some HMOs will come back and share like a report on people that access care and tell you that, oh, you have spent all the money you have given that HMO, or you spent this percentage, or you spent that percentage. Whether we like it or not, yes, it is a business. That's one. But guess what too? Hospitals too still run their hospital as a business. The company where you currently work is still functioning and running. That's the reason why they employed you, to make profit, and they run as a business. So I think it is unfair when people come out without having clear information and knowledge about how health insurance work and say it's a scam and say they've never benefited, whereas they've benefited, maybe them, maybe their family members, maybe that's their children, their husbands or their wives, or whoever it is, depending on the plan that they bought, has enjoyed from it. But just because that you've not fallen sick for a year, did not use it, how does it mean somebody else that put their money together with yours has not used it? So it is very important to understand that aspect. So let me talk about how to use your HMO smartly. Number one, know your coverage. See, I can't tell you the number of people that would call the HMO line, their customer service for their HMO customer service, and rant and complain and say, oh, I went to the hospital, I was denied this, I was denied that. Most times, there are some things that they will tell you is denied, that it is clearly stated in your benefits. Read it, open that benefit, go through it, know what is there. What is not there that you feel like you need access to? Ask questions. Ask questions. Know your benefits. Most people that buy HMO plans don't know their benefits. And let me tell you something, for those people that tend to hop from one HMO to the other, let me just tell you, all HMOs, we use the same sort of benefit structure. Let them call it different names. Somebody might call their own gold, another person call it bronze, another person call it silver, another person calls it whatever it is. The same structure, that's what we use. Sometimes they just tweak the amount just to satisfy, include some benefit that they think that you may not be able to access, or you may not even access for that 1 year. It's just to get you to buy the plan. So if you're hopping from one HMO to the other, have this at the back of your mind. If you think, oh, this one is better than the other, after some time you will come back tomorrow and complain about that one that you think is better than the other one. That is the truth. And I mentioned earlier that there are several factors that are currently affecting the HMO system, which we're really currently trying to really work on and regulate. But the truth is, if you understand your HMO plan, you will not need to hop from one HMO to the other. If you have a particular HMO that provides the service that they told you the plan that you bought is going to provide, stick to that HMO. If you feel maybe their customer service or the service in general that they're rendering is not satisfactory, that's a different matter. When it comes to the benefit that you can access, most of the time it has to do with the premium that you can afford. It is very important. If you feel what you can afford yearly is 100,000, you're going to be giving benefits based off of the structure and the planning and the calculations that 100,000 naira can give. That's what you're going to be giving. Know your coverage. Understand this information. Ask before treatment. When you are at the hospital, ask before treatment. And it's also important to use hospitals that are registered under your HMO plan. I'm saying this, I don't know, mostly out of frustration or things that I've dealt with a lot of Nigerians, but I'm just trying to provide a lot of awareness that will really ease us and really make the system work for us. That's the truth. Ask about your treatment sometimes. Ask before you receive certain treatments. If you need clarification, reach out to your HMO to get clarification. After you've gone through your benefits to even understand what you're covered for and what you are not covered for, try to use hospitals under your HMO's network. It will save you a lot of stress, it will save you a lot of issues, and also understand how the hospital that you chose to use, how their system works. There are some hospitals that they have a separate structure when it comes to dealing with HMO patients, as opposed to patients that just walk in to make direct payments. Don't now get angry with the HMO that, oh, it's the HMO's fault. No. The hospital has a structure for that. There are some hospitals where their structure on how they deal with both private patients and HMO patients is the same. It is very, very important to understand how each hospital's operation work and how the HMO you're currently using, how it works. You would not have issues, or you have less struggles. The next thing is use primary care first. We have processes, we have protocols when it comes to health insurance. Not only private HMOs, even the government HMOs. We have what we call primary care and secondary care. You can't work into a primary care facility under the government plan and say you want to see specialists. No, they're going to refer you out, and you need certain referrals for that. And there has to be a reason for that referral for you to want to see that specialist. We are all in Nigeria and we know the limitations we are currently dealing with when it comes to doctors. We have very few consultants or specialists in Nigeria. I feel like a lot of Nigerians don't want to come to that realization. So they just tend to pour the frustration on whoever is available. Please note this. We have very few specialists in Nigeria. We are all rotating the same specialists, both in the government facilities and the private facilities. Use primary care first. Allow the doctor treat you. Ask questions when you get to the hospital to get clarification before certain decisions are being made. Choose the right hospital under your HMO plan. And HMOs are not necessarily restricted. Most times they provide most HMOs in Nigeria, even government HMOs, provide some form of flexibility when it comes to hospitals that you can use. Like I said, just understand the terms and conditions and their standard of operations. It's very important. Follow the referral process. It is very important. If you do these steps I just mentioned, trust me, you're going to enjoy HMO. You're going to enjoy the insurance plan that you are paying for. The same way you pay for insurance for your car, for your house, for so many other things, is the same way. I want to talk about something that is very common, a very common question people tend to ask. Oh, I buy my HMO plan and they say I cannot access some certain type of care during a certain period of time. Why? It's the same way when you buy your health insurance. You buy your insurance plan for your car, for example. Especially when you buy it alone. There are some terms and conditions. Why? Because the reason why the terms and conditions are there, number one, is to reduce or not to allow abuse of the system. We've seen people that buy HMO plan and they want to pay 50,000 naira just so they can access a 500,000 naira surgery. They know they want to do the surgery tomorrow. They'll buy the HMO plan today, pay the 50,000 naira just because they want to access 500,000 naira surgery. Think about it. Is it fair? We want a better Nigeria and we want a better system. But I feel like part of our challenge is the fact that we are the ones creating a poor system for ourselves. We have something we call retail plan. Retail plan is when you come out to buy it alone without going through your company. If you're buying alone, that's only yourself or you and members of your family. It is very important to ask for terms and conditions. What can I access immediately? When can I ever access this plan? There's some retail plans that you can't even access basic care until after 1 month. There are some they may allow and give room for you to access immediately. But there are some benefits that you cannot access after 6 months, some after 1 year. Again, these are structures that are put in place, both the government one and the private one. Yes. Bear in mind, if you buy the government plan right now, you can't access until after 3 months. Why? Because they go through the process of registration, fixing you, some processes anyways. And again, for the sake of structure and to avoid abuse. Please try as much as possible not to abuse the system or feel like you want to you can take advantage of the system, but not take advantage in the wrong way. Take advantage in a way that benefits you, but not in the wrong way. The truth is, HMO is not perfect, but trust me, without it, a lot of Nigerians will not be able to afford care at all. The real issue is not just HMO. It's the coverage depth, the system funding, policy enforcement, what you can or cannot afford, and the information that you have about HMO and the plan that you currently purchase. I'm advising or rather encouraging every Nigerian, if you've not gotten an HMO plan and you're interested in getting an HMO plan, you can send me a message and I will just share with you the different options available in Nigeria when it comes to the benefits, when it comes to the different private HMOs available in Nigeria, and the ones that I think would be beneficial to you, your family members, your friends, or whoever it is, your colleagues, your organization, your company, your cooperative, your association, or whoever it is that you want to buy the plan for. Remember, like I said, HMO is not a scam. All you just need is understanding, awareness about how the scheme works. Thank you so much for watching today's episode. I'll see you in my next episode. Bye.